loud. There we go. I just want to see it's recording. Yes, wonderful. Okay, so I'm going to share my screen and we'll go from there. Now, where are we? Share screen. I should know this so off by heart, but oh, seriously. Share screen. Why can't I see it? Share screen. There it is in green. All right. There we go. Should tell me which one it's sharing. Sorry, I've just got to get this right. It's not coming up. If I push this over, can you see that?
No.
It's not coming up. When I do the share screen, it's not giving me the, oh, here we go. Here we go. That's it. All right, now share. So you're seeing something different now? Yep. Great. Okay, so welcome. Today we're going to be just going over, I'll make this full screen, sorry, slideshow from beginning. There we go. So can you still see that screen that says preparation for medical nutrition therapy placements? Lovely. So click. So I'd like to begin by acknowledging the Gubbi Gubbi people, the traditional owners of the land on which I am today, and pay my respects to elders past, present and future. I acknowledge that they were the first knowledge owners and teachers. Whoops, don't know what happened there. Go to previous, must be set on some time thing. Oh dear. I acknowledge that they were the first knowledge owners and teachers of food and medicine available in this area. So I'd just like to ask you very quickly to say what countries you're on. Anyone from somewhere different to Gubbi Gubbi country?
Harvey Bay's on Bachelor country.
Thank you. Anyone else? Anyone from the Brisbane area? Zara, do you know what country you're on?
Yeah. I am. I think it's Turrbal people.
Yep.
Yep.
Yep. All right. Well, thank you. Oh, I think this is the wrong presentation. Sorry. This is a student presentation. Oh dear. Sorry. Supervisors, this one. Is that still sharing with you? Okay, sorry about that. All right, just to check in with sites, how is everyone? How are you feeling about having students this year? What are you looking forward to? What are you not looking forward to? And is there anything you want us to help with student placements? So just a quick touch base with everyone, if you'd just like to share something of what's on the screen.
I can start, Tanya. We're always looking forward to having students. We've got some at the moment, in fact, loving it. What are we looking forward to? Oh, I think we just always look forward to meeting different faces and seeing what they get up to. We've got a few exciting food service projects this year as well, so we're keen to get stuck into those as well. What are we not looking forward to? I think we're having a big move into a demountable building
Oh.
shortly, and we're not looking forward to being a bit cramped in that space. So that's probably one thing we're thinking might be a challenge, but we'll wait and see. Anything you can do to help with student placements? I don't think so off the top of my head. Thanks, Tanya.
Thanks, Anna. And if you just want to tell the team where you're located and what your role is.
We're at Redcliffe Hospital and I'm the clinical educator here.
Thank you. Someone else? Don't all fight. I'll do a 10-second countdown. Oh, yes. Who's that? Lovely.
Lauren Gabbett from Sunshine Coast. So I'm in the community chronic conditions team. So we've got students coming up in April at Caloundra, and it's always good to have students. They bring new ideas and are always keen to learn, which is great. I'll be sharing with a recent graduate this year, so I'll be helping to support her with joint supervision. And we've had a few students over the years, so just a bit of a refresher regarding, if there's any changes with what our requirements are to care for the students on placement. And yeah, Tanya's always a good support if we need any help. So.
Thanks, Lauren. I didn't pay her to say that, by the way. Anyone else like to share?
Hi, Tanya. How you going? Hi, everyone.
Hi, good. Thanks, Thierry.
Yeah, we've had some food service students start with us the last few weeks. They're in their final week here, so we're sort of hit the ground running. Yeah, just generally looking forward to the yearly sort of webinar that you do, Tanya. Thank you for doing this and for sharing for all our supervisors. Not really looking forward to nothing really. No, just excited to get the year going, and anything to do to help with student placements? Nothing really. No, nothing comes up to mind at this stage. But I'm sure if there's anything, we'll be in touch, and you're always welcoming in that regard. So thank you.
Thanks, Thierry. All right, I might move on unless someone wants to join in now. Okay. Thanks, people. We'll keep moving on. So check-in from the UniSC. We've got 33 students in semester 1 and 30 students in semester 2. So that was similar to last year, although last year it went down to about 28 students. But what we're seeing is the number of students coming into dietetics is slowly coming up again. So we went through a bit of a dip through COVID, but coming up through the ranks, there are more coming through. 25 to 30%, depending on which semester, have had a previous career or a mature age. Now, I'm finding it hard to define mature age now because lots of students have worked for a number of years before they come in. So they might be 25 or 26 or 29. Do I call them mature age? The distinctions are becoming very, very broad, but I think it gives you an idea that still a third of our students have got some life experience behind them. 6 are doing the honours research pathway. So although our students all now get a Bachelor of Dietetics honours, so they graduate with honours, there's a distinction between graduating with honours, which has a class, so that's a graded level, and then that opens up their career options to do research, a master's or a PhD, or become a research assistant, more so than the students who graduate with honours, but they still are doing more work in their 4th year to achieve that honours level. So, by the way, just interrupt me anytime with questions. So, although I'm saying new here, it was really last year that we'd put in more competencies related to Indigenous and Torres Strait Islander and interprofessional collaborative competencies. We're still working on that to embed it in the program from early years through. But it's not simple, and we want to do it well. So we're working with statewide and national dietetic groups to do that well. last year we had a real focus on student wellbeing. And so I just wanted to ask you your thoughts on those changes from last year, including the Indigenous and Torres Strait Islander and the multidisciplinary team meeting and encouraging students to observe another health profession and giving students a bit more time to work on their pebble pad. Any comments?
Hey, Tanya. I think that was a good idea, sort of trying to pare back and take the pressure off students a bit. And I do think it can help if they're not so stressed. Sometimes, you know, placement's really stressful. It can be really hard for them to think clearly when there's all these extra pressures on them as well. So I think from that point of view, it seemed to help. I'm not a student, but they seemed like it helped a bit in that way. But I guess something we sort of struggled with a bit was giving extra time for these other activities sort of tended to take away from time seeing patients. And then we kind of found that we struggled a bit with the clinical reasoning, especially later on, like the second block sort of placements. And I'm sort of keen to hear if any other sites had ideas on how to kind of find that balance, I guess, between we don't want to overload them with too much to do, but we also want to make sure they've got enough opportunities that they can practice their clinical reasoning and progress some of those things.
Well, I'll just jump in there because I did want to ask, but I may as well just say right now that we've reduced that. Number 3 is this year we've reduced the amount of work required for Pebble Pad to reduce student workload issues. So we've been part of that thought process. So I'll just jump in and put this in anyway. So they no longer have to do SMART goals. We'll just keep it with the 3 goals they get with their supervisor when they're having that feedback session like the old days. What we have tacked on to the SMART goals is just a strategy for each one. So just to embellish it that little bit more, but that's sort of at point of time with the supervisor. So don't have to go away and write up SMART goals. They also don't have to do a guided reflection each week. That's built, we know they're reflecting because they're having the feedback forms with the supervisor and especially with this student-led approach. And also there's the quality reflections that they're doing in relation to seeing a client that identifies as Aboriginal or Torres Strait Islander or of some diverse background. So that's 2 big things that they've got less. Last year we made it 1 case study instead of 2. So anyway, we're hoping that that will help with that. Any other comments? I didn't mean to stop the discussions.
Tanya, I think having that extra time during the week for students to work on their Pebble Pad has been good. We've sort of allocated an afternoon for students, and I think their feedback was, they responded quite well to that. They enjoyed that time. Just from our perspective, it can take a bit of organising just to get that spend some time with an Indigenous or Torres Strait Islander sort of key worker or finding someone from a culturally different background. But yeah, just working with that and just trying to plan that and just to make sure that the student has time to observe those. Yeah, we appreciate that. So thank you. And yeah, we are trying to scaffold learning from earlier on in the year, earlier on in the program to help prepare them for that experience in 4th year, but it just takes a little time to get incorporated. Rose, you've got your hand up. I don't think I can see everyone who's online on my screen, and I'm not really great to know how to change it.
That's okay. Sorry, I'll just butt in next time. But
yeah, just butt in, people, if I'm missing your hand.
Wanted to say, and I'm more like an accessory support supervisor. However, we had a few students come through Nambour last year, and just to support what Anna was saying, that these things are all good to try to incorporate these activities, but at the end of the day, I really do think it does eat into that important clinical reasoning and just the general clinical placement. They only really, their time in clinical placement is still so short. And when you add in often having time off whether it's through illness or other things. And something that I thought was very effective last year was reducing that requirement for 2 case studies, because the students get very obsessed with those case studies and the preparation for them, when if they're only doing one, they can really think about it, plan for it, and they're a bit more well versed in how the whole process works with doing that. And it's good to hear that there's further reduction with the Pebble pad requirements, and just to really hone that down. So yeah, that all sounds good. And
Thanks, Rose.
also the Indigenous and Torres Strait Islander requirement, often that was quite difficult to achieve without sort of making it a specific activity where, again, it does it. So it's good if you encountered that sort of experience as part of the normal everyday working, but to organise a separate session with personnel who were working in that space was, again, quite challenging at times.
Yeah. Thank you. Anyone else? All right, I might move on. Once again, just stop me or interject. So otherwise, the broad MNT placement program hasn't changed. It's still 10 weeks full time. We don't have set milestones for the weeks. We have the 10 weeks plus or minus 2 if they need extra time. They're still having 1 week in the USC student-led nutrition and dietetic clinic prior to going on placement, where they're practicing diet histories, basic counselling skills, and starting with documentation. The weekly feedback process and forms using a student-led approach, that continues. The weekly USC student tutorials on Fridays from 3 till 4:30 via Zoom continues. Now, you'll probably notice that they finish at different times. If there's less students, we'll finish earlier, but we also recognise that some students' working days finish at 4, so there's a little bit of just expect a little bit of leeway about that. There'll be 2 phone calls with supervisors per block, so week 3, 5, 8 and 10. So it's not necessarily every fortnight, but there's definitely 2 phone calls with supervisors, and continuing the weekly phone call with the student. So we're continuing with the 1 case study presentation in the final block, 5 SGAs or PGSGAs, which must include a physical assessment, 1 enteral feed where the student does the calculation and documents, and 1 nutritional assessment. So that's over the whole 10 weeks. So if they don't get to do it in their first placement, it's hoping that there can be some facilitation of that in their second placement. In pink, I've highlighted another reduction in expectations. Students are no longer required to take a group education. Now, that had already become a bit hit and miss anyway, but we're just taking the pressure off because we've now included this as part of their dietetic practice management course in NUT 407. So as part of learning how to run a private practice and business, they're all doing some form of community education in that course where they've got time to prepare, and they go out in the community and do a proper group education session. But that's not to stop if you do have the opportunities, and like in the community setting where there might be those opportunities more widely available. It's not to say that students are not to participate in group educations. We still want that to continue wherever it's part of your normal workload, but it's not that we're sort of advocating for students to, please, can you find a group education for them to do? That pressure's gone. We're still encouraging, if you can, see whether there's an experience with a client that identifies as Aboriginal or Torres Strait Islander, and if that's not possible, if there's a potential for them to spend some time with the Indigenous liaison officer. If that's not possible, just let me know. I don't want that to be a big burden. And then we're hoping that they might have 1 experience with a client that represents a diverse population group, either from culture, religion or gender. 1 occasion to attend a multidisciplinary team meeting, and 1 occasion observing another health profession. Are there any comments on how that went last year with observing another health professional maybe, or attending a multidisciplinary team meeting?
I think they're all really valuable goals to have, and I don't think they're unrealistic at all. I think that all sounds very good.
Tanya, just extending on what I was saying before, I think it's just dependent on time and just organising that time with that Indigenous liaison officer, that it doesn't impact on any clinical prioritisation for the student. Yeah, it's just trying to marriage that up.
And it's also, you know, what are the demands on the Indigenous liaison officer as well? You know, there might be a family sorry business and things like that where it's just not appropriate. So, yeah. And observing another health professional, I think that helped some sites based on some other feedback to actually book that in, whereas they hadn't thought that as a priority. But I think it is a priority that they get that chance, and it is an important way of clinical learning. So thank you for that, and thank you for all your efforts last year with building that in. So, as I said before, the pebble pad and progressive tasks are reduced, no longer weekly guided reflection or SMART goals. They'll still reflect and set goals and strategies with the supervisors weekly. And that's the one change on the feedback forms, that there's space for 3 goals. There doesn't have to be 3 goals, but underneath the goal is a strategy. So we really want them to articulate what they're going to do. Everything else is the same. It's the same. So some of this will be repetition for those of you who've had our students regularly. So we don't have set milestones for weeks because we need to consider different caseloads that students work in, different contexts, how many supervisors they get. That all has a bearing on how competent they can appear to you at the end, but we need to build a holistic picture of what's been going on and focus on that basic competency level. So weeks 2 to 3, this is just generally how some students might progress. Some might go faster and some slower. So this is not to hold students back or to push them any faster. We just have to go with what we see. So weeks 2 to 3, practicing information gathering and observing supervisors, taking diet histories. Week 4 to 5, practice determining nutritional status and nutritional diagnosis for simple cases and simple interventions. Week 6 to 8, really getting stuck into the diet disease relationships and educations. And weeks 9 to 10, time management, less supervision and exposure to more complex cases. The e-portfolio, they do still need to keep their MNT placement statistics. So they will be keeping their own statistics, which are different to yours. They're de-identified. It will talk about the medical condition of the patient, the nutrition diagnosis, and what they did. They'll also be recording statistics of what they observe, because that's a learning experience. We don't want to lose that. So, and they will be indicating what they did with that client. So it may be nothing, that they fully observed a peer or fully observed a supervisor see that client, and that's fine. We just want to have that in there as their learning experience. Their weekly feedback forms, their case study presentation. They still need to do an analysis of one diet history in FoodWorks, some reflections, and I forgot to mention before, reflections about observations of effective and ineffective multidisciplinary team communication. The resources are all the same, and you will have I've sent all the resource kit to the clinical educators. If you haven't yet received that, perhaps just give them a reminder to forward them on. So the placement guide, the medical nutrition placement site guide, the peer assisted learning guide, a digital copy of the student workbook, which has all the feedback forms in. So you can either complete them online and then bring them to your feedback session, or you can print out a copy and complete it with the student there. Dietetic supervisor and clinical education CPD. So I'll continue to feed out to the group if there's education sessions on that may be of interest to you. Check in with the DA, Dietetic Clinical Educators Interest Group, if you want to know some other things that are going on. There's some resources there. I've got a copy of a form which is helping students with clinical reasoning. That was a webinar that I put together, and there's a form that goes with that. There's the DA Dietetic Educators Interest Group library, and it lists what's there. There's a recording of student-supervisor relationships to foster student reflection and learning. That was from the DA conference last year. And a recommended journal article, We Are Our Own Worst Enemies, a qualitative exploration of socio-cultural factors in dietetic education influencing student dietitian transitions. The resources are the same. This just lists the topics that they cover in MNT in third year. Pre-placement preparation. So they will have done these mini modules prior to coming on placement, which are broader than just MNT. So cultural awareness, the healthcare team, navigating patient information, accepting feedback, clinical handover, difficult communication, graded assertiveness, student-supervisor relationships, documenting in medical charts, and teamwork, as well as managing your well-being. And this is a snapshot of what they have available. I'm just going to race past this. Now, I just wanted to pause here and just have a bit of a reflection about when the supervisor meets the student, setting the scene. So this is something I haven't focused on before, but it's come up in discussions with students. And once again, it's just thinking about how busy supervisors can be and what can easily be missed. But just like we always say, first impressions create a lasting impression. That first time that you see the student, if you could just allow some time, so to help them feel welcome, to help them feel like a person, and for also to allow you to get to know them as a person. So, you know, at some stage in that first week, if you could tell your stories, how you came to dietetics, maybe find out about their story, how they came to dietetics. Setting down expectations. So students, we assume they know what the expectations are of students, but depending on where they are in their placements and depending on your workload, actually, our expectations are all different. So try to let the students get into your little black box in your brain, which you know what you're thinking you'd like them to do. Let them in. So whether it's 1 to 2 patients a day, what are their goals? What times you're kind of expecting them to gather data and write up. And I think talking about times is really important because I think 6 hours a day on a patient's too long. They need a bit more guidance. You do have to go in and say, okay, where are you up to? And then show them. They'll learn by showing, okay, what have you got? What haven't you got? Because they can be wasting a whole lot of time. Your guidance in that area is good. So try to think about what your expectations are of the student and put that around your plan of the week so that they know when you're not going to be available. Or when, like I've got here, share your diary. When are your multidisciplinary team meetings? When are staff meetings? And we'd encourage you to let the student come to those meetings. They learn so much from that. They're not just learning clinical, they're learning the whole of patient care and how dietitians work. As you plan your week with a student, please remember to book in times when the student observes the supervisor. This should be the whole 10 weeks along. It's not like the old days, they only observe in week 1 or 2, or when they get a new supervisor once, and then at the end, they don't get to observe at all. Every time they observe, they will have had other learning experiences in between, and they're going to pick up more of what you do or different depths or have different focuses when they're watching you. They can't take everything on board at once, and what they observe in the first week will be totally different to the end week. So it's about that last year, how we're talking a bit more about quality rather than quantity. I mean, the two things are important. But this is a way that we can ensure quality of placements. So when the student observes a supervisor, it doesn't mean that you have to explain everything or that you have to slow down. You can just say, this is going to be an observation. Take in what you can, what you can't, just leave. That's fine. I've got to get my work done. You can have a look at my notes afterwards so that they can see what you're doing. But please allow that minimum. And that has been run past the state clinical educator coordinators consistently. And this is what they've said the expectations are for you as supervisors. So minimum across the 10 weeks, the student observes the supervisor twice. And as a minimum, the supervisor observes the student twice. It's very easy to get into what we call long arm supervision. Sorry, that's supposed to be a long arm, not a big hand. Long arm supervision, where you just get their oratory on what they've found and then you check their chart. You don't know what they're missing. You don't know how their communication's gone. You don't know how their interaction with the nurse or the doctor's gone. We can very easily jump into those assumptions because we're busy. But at least twice a week, if you could plan to observe them, the student, with a client. It doesn't have to be for the whole lot of the time, but at least for some part of the time. In your planning, weekly planning, please book in that formal feedback, ideally on a Friday morning, so it's closest to the end of the week, or Friday afternoon. And then you can tell the student when that's going to happen, so the night before they can go through their feedback forms to guide that student-led approach. In terms of supervisor meeting the student, setting the scene, once again, do you or they eat lunch with you, with the team? Or is it just morning tea with the team? Just set the scene, then they won't feel like they've just been left at lunch. Breaks in a day, what you do versus what they can do. So you mightn't take a lunch break, you mightn't take an afternoon break, but we shouldn't really be passing on our bad habits to them. Plus, they haven't actually got that fortitude of, they haven't necessarily learnt how to run all day and stop thinking. They haven't been, a lot of them haven't been working full time for years. They're not used to being on their feet. They're not used to having to eat enough in one sitting that they can't just snack and drink the whole afternoon. So that's part of them, once again, learning how we work, but we can't expect them to change from one time to another. I know one student mentioned one year about, oh, I can't even get to the toilet. You know, they're used to being able to, or they've got habits of going to the toilet, you know, every hour, but the supervisor might think that's kind of funny. So it's funny what we think is normal, a normal way of working. So now we're going to go into a feedback, focus on feedback again. So I'd love to ask you a few questions, and if everyone could try to just contribute one thought to the group here, I'd be most grateful. So I'll list all these things. What do you remember about supervisor feedback when you were a student? What stood out? What did you like? What didn't you like? And what do you think comprises quality feedback? So there's a whole lot of things you contribute. Just the first thing that comes to your mind, if everyone could contribute something here, that'd be great.
I can start. What I remember about supervisor feedback when I was a student, my supervisor used to ask me for a couple of positive things I thought I did well before things I thought could be improved. And I liked that and didn't like it because I found it really hard. We're so used to just noticing, oh, I could do this better, I could do that better. It was sometimes quite hard to pick out what did you do really well. But I thought it was also really important to focus on what you are doing well, and something that I try to carry over these days, because I think it's important to think about what's going well as what could be improved. There's so many things always that you could do better. It's nice to stop and think, oh, actually, this time that went a bit better today. So I think balancing the negative with the positive is really important.
Thanks, Anna.
It's Melissa from Nambour. I agree with what Anna said, but the thing that I quite enjoyed, appreciated with supervisor feedback was getting one-on-one time. I know for my first placement, I was with another student at the same time, so it was kind of, you feel like you're kind of blending into the background at some stage, but if you had that opportunity to get in a room and sit down together and actually have that one-on-one time, I thought that was good for me.
Thanks, Mel.
Can you hear me? This is Dana here.
Hi, Dana.
Yeah, hello, Tanya. I'd agree both, with Anna and Mel there. I do think I find, that I like that positive feedback, what I did well to help. I find it helps the students focus on what they're doing well, because often they're thinking what they didn't do so well. So it helps frame that. And on the run, the quality time, definitely one-on-one, but also I like the when I was at the Royal Brisbane, having that feedback after seeing the clients on the run, just walking back. So I kind of got feedback straight away.
Yep.
Yeah, so a bit of both on the run and that quality one-on-one separate time. Yeah.
And Yang, I can see your hand up.
Hey Tanya, can you hear me?
Hi, yes, I can.
Great. I thought I'd just share my point of view as well, just from what I recall as a student. It wasn't so much what was fed back, it was more about how it was fed back. The one thing I distinctly remember about the good supervisors I had was how compassionate they were and how approachable they were with the feedback sessions. And I know it really does impact on the stress levels and the mental health side of things when the supervisor delivers feedback in not a great I don't really I'm lost for words right now, but yeah, when they're not as compassionate as they could be, and just respecting that there is complexity involved, there is inexperience involved, and that there's a whole lot of stress involved. It's not just clinical case management, it's assessment, it's competency, it's am I going to pass my degree? You know, it's all that each and every day. So that's what I took away as a student.
Thanks, Yang. Thierry, you got your hand up.
Yeah, I think I liked that it was timely feedback for each of those assessments, which was good. Sometimes it can be a bit what I sort of didn't like was if it did take a long time, or you'd do other assessments and you'd go back with that feedback later on at the end of the day, a bit of a summary. I think something that comprises quality feedback is, that it's timely and one-on-one, and that it's sort of structured, sort of goes back to the competencies as well to give you that direction as well. So yeah.
Thanks, Thierry. Now I can't see any other hands. Would anyone else like to contribute?
Hi Tanya, it's Yolanda.
Hi.
Hi. I remember some feedback from supervisors was really like specific. So they told me, you know, what I did well in parts of the, you know, information gathering or delivering of education or whatever. I feel like that really stuck was when it was like specific and I knew, what I did well.
Yep, great.
Tanya, hey, it's Deb. How you going?
Hi, good, thank you.
Hey, I was a student quite a few years ago when we weren't allowed to talk to the dietitians. We weren't allowed in the dietitian's lunchroom or their unit at all. So I think, like, I've worked really hard to try and make placements really so they feel part of the team. Yeah, and I think we've done that quite successfully to try and incorporate them, make sure they're involved in any case reviews, mini case reviews, meetings, and everything that everyone said, try to make it timely, positives. Of course, not everything's going to be positive, but make it specific and things that they can keep working on.
Great, thanks, Deb. Do you want to just say where you are? Some of the oldies may not be.
Sorry, yeah. So I'm in Community and Oral Health for Metro North. So I actually work in the complex chronic disease team at North Lakes, and I also work in the community transition care team at Brighton. And then at the moment, one day a week, I'm doing the clinical educator role for CO as well.
Thanks, Deb.
Thanks.
Anyone else just before we move on? Okay, we'll keep moving. Thanks for that. And they're all absolutely, when you look up, if you put into Chat GPT, what makes effective clinical feedback, which I did just before this to check whether I was on the track, they're all absolutely right on the track. You've got it to the money. We might go past this just in the interest of time. And what I've just put in here is try to think of something different. Can you think of trying a different way of doing feedback? So there's different approaches. I've talked about this at different times in different ways, but the main thing is to let the student lead the feedback, because that way they've got the upper hand and they can show insight into what they're doing well or where they need to keep working on. It's so much better if they can do that rather than someone else telling them what they know, but that's more in a if it's someone else talking first, that just reinforces that authority gradient and may not contribute to a conducive environment where they feel they can speak up, which we want to encourage. So the KISS is what Amanda used to do. Now Deb's filling in for Amanda. So the keep doing something, improve on what you're doing there, stop doing something and start. So that's the KISS principle. Another thing to try is 2 positives and 2 negatives, just keeping it really simple, you know, for that ad hoc feedback, because it's a problem to give too much feedback. It's too much to work on. It just all blurs and all they'll remember is the negative. So it's a really good idea just to pick on a couple of things and keep it simple. Or the what went well, what didn't go so well, what would you do differently next time? And just stop there. Don't go further and further and further. Because sometimes there's too much reflection and introspection. You want them to move on to the next case and just give it a go. The other great question to ask is, to what extent were you able to achieve the goals you were working on? So that brings you back to their goals and them back to their goals as well. If they're setting goals for the week, they're the most important things that they should be working on. So there's an element of, let's not put more things on their plate. Let's really focus on those big ticket items that when we had a chance to stop and think were the most important ones. So it's that less can be more. One technique of doing this is to complete the feedback form while you're observing the students, but don't give them that one. Stop and think. What is the most important thing for them to focus on? And with that, of course, to make sure to go into what they've done well. Pick out why they're doing it well. Have a think about why they're doing it well. That way it'll be more meaningful, positive feedback, and we'll make sure that you spend hopefully as much time in the positives as it is with the constructives. That's what gives the balance, because I'll have students say, when they're struggling with a student supervisor feedback process, they'll say, they don't tell me anything positive, and I don't believe that for a second. But what we can tend to do is say, look, you're doing fine with that and that, but, and then we spend a whole 15 minutes talking about what they need to improve. So it's trying to keep it a bit of a balance. And if it's positive feedback, trying to think about why they're doing it well, to just give a little bit more extra time on that. As we know with children, we're the same. Praise and affirmation leads to better progression, a happier, more confident student, and a happier and more relaxed supervisor, because you also need to focus on what they're doing well rather than on what they're not doing well, because you get the pressure. You're the ones who tend to feel like, oh, I've got to make them competent. I've only got this many weeks to make competent. That's not actually your role. Your role is to provide them with a quality supervision experience, and where they take it is up to them. And that depends on their capacity, what's going on in their lives. So just trying to take off that pressure. Are there any comments there?
Yeah, Tanya, with the feedback, I think even just having a plan prior to the assessment, yeah, relating it back to that competencies, just for like a simple example, like introducing yourself.
Yes.
And just and stating what the student dietitian's there for, why are they coming here to see the patient. Sometimes, you know, or for MNT1 students, they've never sort of talked to a patient or had that patient student sort of relationship. So sometimes we just I just focus on how to introduce yourself, how to set it up, how to make the environment conducive. So sometimes we'll plan, well, how are we going to do that? And that helps focus the feedback afterwards.
That's
Let's not worry
great.
about everything else. Let's just focus on that introduction, the communication, and then that help, and then that's how we discuss the feedback, and the student can lead that.
And I think that's like setting the expectations at the start. So it's really good to do that beforehand, and you're linking it with their goals or what they need to work on. So yeah, I think that's great. And the rest, that's fine. You can just sort of gloss over the rest. That was fine. We'll keep working on things. You'll only step in if you need to, but it's just focusing on that key area for that time.
Tanya, can I ask a question there? It's Adana here.
Mm.
Yeah, in relation to the, it's not up to us to make the student competent. It's our responsibility more so just to expose them to, observation experiences. So the students, so they're aware of that, are they? That at the end of the day.
Yes.
Yeah. Okay. And so early in an earlier slide, it mentioned the placement like 10 weeks plus or minus 2 weeks. So if they say needed an extra 2 weeks, is that the 2 weeks in the clinic, or is that the 2 weeks like in their placement?
We'll consider what their learning needs are, and consider what options we have available. So if they really need remedial support from the get-go, we'll probably put them in the clinic where they'll get really close supervision, and we can really hone in on those areas. So the poorer students we'll probably put in the clinic for 2 weeks. The other ones, if they specifically need, like last year, we knew a client was actually quite proficient in the clinical environment and in the community environment, but for whatever reason, when they transitioned to hospital, they really struggled. So we liaised with the hospital they were in to keep some consistency. Were they able to provide that student with an additional 2 weeks in the hospital? So for that student, we tailored it to their needs. So we really try to find out what level of support they need, what level of experience they need.
Thank you. Yeah, that's good.
Any other comments, thoughts? Okay. I've kind of gone over this, giving positive feedback and let that override the feel of the session. And that's where Anyang mentioned, it's the way it's presented. So if you step back and have a think about, how did that session feel? Did it feel like it was positive and constructive, or was I too busy and just had to focus on the negatives, and how am I going to change that? So quality supervision relies on supervisors reflecting as well. Are you giving too much feedback, which is nitpicky, not focusing on the big ticket items that are most important? Now, I put this in because this is commonly seen in new supervisors and early career dietitians. I find that they tend to be more focused on the negatives. I think partly it helps them feel better about themselves because they do know what a good consultation is, but they're not. They somehow are harder on students than what a more experienced supervisor is, who can see the big picture, who've seen students with, coming in struggling, making it by the end, and that's what I'd encourage new supervisors to think, that less is more, not being too nitpicky, because it actually doesn't help. And what experienced dietitians will do, or good supervisors, I find, are more relaxed. It's like, it's going to be fine. Generally students get it by week 10. Don't stress. You've got plenty of time to do this. So just calming down about that, and nitpicky feedback, they'll work on that, or that will become important later on. It's what's important for now, like that introduction, what a dietitian does, or whether it's the clinical reasoning, or whether it's making sure you go back in past histories and you can say a good background. So, but yeah, I do often see new supervisors and early career dietitians being quite nitpicky, and actually, even for me, hard to bring back to the basics. So hopefully there's some tips in this discussion today that they can take on board. Regularly interrupting students. So it's best to give them room. let them not be perfect. You can add or fix what they've said in the end, but give them room, because there's nothing worse than a student saying, I was going to get to that, and I'm just as guilty of that, but it's just part of that expectation of yourself. If you're setting goals with the students pre-going in, it's like, what are your goals for yourself before you go in? Is it going to try not to interrupt this time and just leave it to the end? And that can be part of setting up your expectations as well, telling the student, I'm going to try not to interrupt, but at the end, I want you to ask me if I've got anything to add. And that's where I can do the fix up or contribute. Something that some supervisors get caught up in is, do you have to observe the students all the time? Are you really giving them a mix, even in the early days, really helps affirm them and make them feel like they're able to do something. So even if it's going into the client on their own, talking to them about what supplements to go on and organising supplements, letting them do that on their own is a great step to help them make them feel confident and improve their skills. So you don't need to observe the students all the time. It's very unlikely that they will say something that's totally out of whack. So just think about when you can start more of that hands off. Do they have to document things exactly the way you do it, even if they have more supervisors? This comes up every year. It's really hard for students with 3 or 4 supervisors. They have to have their own black books, saying, okay, with that supervisor, I have to make sure that I've got a PES statement that's at least 4 sentences long, if not 5. With that one, they just want a simple PES statement. With that one, they want a summary of the diet history. With the other one, they want me to write out the whole diet history. So that's just supervisors, you're usually in contact with each other. Please be aware of your own way of doing things and try to stop and think what matters. Because just like we're looking for basic competencies with their skills with patients, we're only looking for basic skills with documentation. Some of you are A+, documentation is your thing, but that is a skill that you've honed over the years or has really been your baby. Other supervisors don't have that level of emphasis, and it can really hold students back because they're always trying to please and always trying to do the best for you. So please talk about that amongst yourselves with supervisors and with your clinical educator, who can try to help you through what your expectations are. Any comments there? So the purpose of the forms is to enable supervisors to spend once a week facilitating student learning through reflection. It's also to gauge student insight into areas for development. Just a reminder that the weekly feedback forms start as week 2 because their first week in placement is week 1. So that's the same as last year. Feedback forms are in the same place. The forms are exactly the same, except that we now have 3 goals and 3 strategies, and they don't have to have 3 if they don't have 3. It can just be 1 if that's the most important thing you want to do. Everything else is exactly the same as last year. And just to remind you, in the student-led feedback cycle, there's informal and brief feedback daily, and in the centre we have 2-way discussion and reflection, so it's not a supervisor just saying what they think. Encouraging the student to speak first, and then the supervisor to affirm or slightly amend or correct if they need to. Then there's the weekly formal feedback, and then together it's drafting 3 short goals and strategies with the supervisor. There's no longer the need for the student to work on the SMART goals and Pebble Pad over the weekend, or to discuss or show the supervisor the SMART goals on Monday. It's just going back to what it was before. Still 2-way discussion and reflection. I think I'm going to skip over this in the interest of time. We've got 2 minutes. So these are just the forms, and these I will send a copy of the PowerPoint if people want to spend a bit more time, the NCP feedback form and the skill development feedback in weeks 4 and 8. MNT placement issues. I've just written there about that, ensuring that students can observe supervisors twice a week, and that supervisors are observing students twice a week. Other things I've gone through as we've talked about it, more than 3 supervisors a week I would consider very difficult for a student to work in. And I have discussed this with the clinical educators in a meeting last year. Everyone's got resource restrictions, but really if there could be less supervisors, that's makes it a better student placement / experience. Final assessment is still the same. I'm going to skip over that. That's the end, and it's 12:59. Any questions or comments?
No, Tanya, thanks for a good webinar. It was great. Thank you.
Thanks, everyone. Any other comments?
Yeah, thanks, Tanya. And I will have a look at those last few slides, because some of that it did look quite relevant. So yeah,
Okay.
but it's all nicely highlighted and everything. So yeah, but thank you as always for
Thanks,
the very
Rose.
helpful webinar.
Thank you.
Thanks, Tanya.
Thanks,
Tanya.
Sarah. Thanks, Anna.
Thank you.
Thanks.
Thanks, Tanya.
Thanks, Yolanda.
Right. Thank you so much, Tanya. I appreciate that.
Thanks, Group A
Bye.
Legends. Bye.
Bye.